of you who are joining us in person as well as virtually tonight. We actually have over 200 registered attendees virtually. So welcome everyone. My name is Jared Bigman. I'm the Senior Director of Development here at the UC Irvine Samueli Integrative Health Institute. We're so glad you're here to join us tonight. This is our free community lecture, Integrative Insider Live. These events occur usually every month or every other month. We bring in clinicians, speakers, researchers, members of our medical team to be able to share information with you. These events are open to the public and dedicated to sharing insights on integrative whole person health. All registrants today will receive a follow-up email with a link to the recorded session. Our main clinic on UC Irvine campus is designed to best empower you on your whole person health journey. We also offer integrative services at UCI health sites in Newport Beach near Fashion Island, Pacific Breast and Oncology Hematology at Pacific Medical Plaza in Costa Mesa, Yorba Linda, and Laguna Hills. Before we start, a few Zoom housekeeping items. We are recording this session. All registrants will receive an email with the link to the recording. And to minimize distractions, everyone will remain mute and video off. Please utilize the Q&A feature at the bottom of your screen for any questions or to communicate with us during the session. After the presentation, I will moderate the Q&A session. Now on to the main event for tonight's session. And because we are in a new year, many reflect on their lifestyle and set some goals or resolutions to improve their health and well-being. We will explore integrative approaches to leveraging intensive lifestyle modifications to optimize sleep, maintain a healthy weight, and improve mental well-being with our staff physician, Dr. Christopher Gabriel. Dr. Gabriel earned his medical degree from UC Irvine School of Medicine. Oh, cool, and completed a combined internal medicine and psychiatry residency right here at UC Irvine Medical Center. His passion for integrative medicine started from a young age where he utilized yoga to heal several sports injuries. His unique training in internal medicine and psychiatry allows him to thoroughly evaluate for root causes of both physical and mental symptoms. And he is adept at understanding the interplay between the mind and the body. Dr. Gabriel's clinical interests include lifestyle medicine, integrative weight management, longevity medicine, integrative behavioral health, and primary care. He places a large emphasis on optimizing lifestyle factors such as sleep, diet, exercise, and mind-body practices, yoga, meditation, and breath work to heal chronic diseases. He has additional experience in integrative mental health, sleep medicine, bariatric medicine, psychotherapy, and primary care. Dr. Gabriel utilizes a holistic approach by combining conventional medical treatment with integrative modalities to provide a comprehensive treatment plan for his patients. Please join me in welcoming Dr. Christopher Gabriel to Integrative Insider Live.
Thank you all for coming. Can you hear me okay? Really excited to be here and also very excited to be a part of the Susan Samueli Integrative Health Institute. Now, I've developed this talk over years of treating patients in both internal medicine and psychiatry. And during that time, I've really found an interest in preventing illness before it begins. And further, once illness does begin, I like giving people options, which led me to get specialized training in integrative medicine. As Jared mentioned, this talk is mainly going to focus on lifestyle modifications. And while the title says mental health, these lifestyle modifications will be able to help with both physical and mental health. So let's get into it. So this slide is basically just an introduction slide. And what I want to share with you with this slide is kind of why I think that lifestyle modifications and supplements are, while helpful, can also sometimes be harmful. And so what I mean by that is when we go to a physician's office, oftentimes we present symptoms and then we leave with a prescription or a supplement or an intervention. And in those moments, what's kind of subconsciously happening is that the power of healing is placed on that, whatever it is, prescription, supplement, intervention, medication. And while I use all of those things, I use medications, I use supplements, why I really like behavioral and lifestyle modifications is that they kind of flip that script. So when you're using a medication or a supplement or an intervention, like I said, the power of healing is on that thing. And then when you use lifestyle interventions, the power is on you because you are the one who's ultimately implementing those. And psychologically, that kind of shifts the power to you. And again, so what we're going to do today is we're going to focus on evidence-informed lifestyle interventions for optimal mental health and physical health. And so the ones that we're going to be talking about today are going to be sleep, diet, exercise, and at the end, we'll talk about some non-pharmacological behavioral strategies to improve mental health symptoms. So first, we'll start with sleep and some evidence. As many of you may know, poor sleep is linked to various health problems. So, metabolic disease, Alzheimer's disease, and mental health problems as well. Anxiety, depression, even increased risk of suicide. And what got me onto this topic was actually the study that I listened to, or that I heard about on a podcast, where they took healthy adult males and they sleep deprived them completely. So they didn't sleep for one night. And what they did was they actually measured the fluid that surrounds the brain, called the cerebrospinal fluid. And they found that after one night of poor sleep, there were higher levels of amyloid and tau protein. And these are two I don't know how much you guys, keep your tabs on the news, but anti-amyloid therapies are actually, starting to become used for Alzheimer's disease. So, not saying that lack of sleep will give you Alzheimer's, but I think it's reasonable to suggest that the better you sleep, the lower your risk of Alzheimer's will be. And so that's what this study showed. Another study showed that 8,000 teenagers, if they didn't get enough sleep, that was actually the strongest predictor of suicidal ideations, attempts, and completed suicide. And then this last study was in rats. And basically, they did the same thing. They sleep-deprived rats and found increases in specific chemicals that we actually often either target or don't want to have in depression and anxiety. So for some examples of those things, oftentimes, in severe depression, we actually give thyroid hormone. So sleep deprivation in these rats caused a decrease in thyroid hormone. It caused a depletion in norepinephrine. So as a psychiatrist, someone is going to prescribe a medication sometimes that will increase norepinephrine. So this is just kind of describing the importance of sleep. And what I'm going to do on this slide is actually back up a little bit and talk a little bit about circadian rhythm biology. And it's very complicated, but it's this idea, and I'm going to kind of make it surface level, but the main idea is our body is all on a 24-hour clock. And one of the key players in regulating this clock is actually melatonin. So melatonin actually has an inverse relationship with wakefulness. And so what that means is UV light is actually hitting your eyes, going to your brain, and from there, melatonin levels decrease. And the decrease in melatonin is what helps us wake up at night. On the converse end of the spectrum, a lack of light actually increases melatonin levels. We know this is important for mental health perspective because there have been studies kind of focusing on regulating the circadian rhythm and regulating sleep. And we find that people with bipolar disorder, who often suffer from sleep-wake dysregulation, it actually prevents them from having episodes of bipolar disorder. And the reason why this is so important is because modern society significantly disrupts this process. So what I mean by that is, all of us here in this room, we're viewing UV light, I'm staring at a screen, you're staring at a screen. And so all of that completely dysregulates the natural body's clock. So how do we help with this? So part of it is something called sleep hygiene. And so I'm just going to kind of go through some of these steps to improve your sleep hygiene. So the first bullet here is this idea called chronotypes. So chronotypes are this idea that, some people like to go to bed early and wake up early. Some people like to go to bed late and wake up late. And that actually is supported in the science. And, it's not just that you can't wake up at a specific time. It's different bodies have different times that they want to be awake and asleep. And so if you are able to, if you have the flexibility, I don't, but if you do, kind of shifting the way that you work. So, optimizing your work schedule to be when you're most awake. and going to bed when you were most sleepy. Regardless, it is very important to keep a consistent wake time, and sunlight exposure, kind of going back to the previous slide, can help us actually start that melatonin cycle, and it can help us kind of regulate that circadian rhythm better. So sunlight is the absolute best version of this because that has all the different UV lights that reduce melatonin. And then we want to do physical activity again earlier in the day. So I'll get to this in the next bullet, but we don't want to do physical activity about 3 hours before bedtime. Next, as I kind of alluded to, we do want to limit screens if possible. And then if not possible, there are all these different things that you can do to your computer or your phone that you can really filter the blue light out to really reduce the impact that it has on your circadian rhythm. A bedtime routine can be very helpful for people. So that can include many different things, but ideally something that relaxes your brain, doesn't really activate you. So, no really exciting shows or even really exciting books. Really try to do something that's boring, that doesn't really, stimulate your brain. We want our bedrooms to be very dark and cold. So actually, a reduction in our core body temperature is what helps us go to sleep. So keeping your bedroom as cold as you can tolerate is actually very helpful.
Just agreeing with everything you're saying. It's like he's like, I've been doing all this for years. I'm like, just stop.
Yeah, no, that's good. That's good. We also want to remove clocks from the bedroom. Anytime you look at the clock in the middle of the night, you're giving yourself this jolt of anxiety that ultimately is making it harder to fall back to sleep. Caffeine. So caffeine, this is very heterogeneous. Some people can drink caffeine at 9 p.m. and fall asleep. But if you are struggling with sleep, I have a hard, I guess a soft rule that you shouldn't have caffeine past noon. Reason being is caffeine actually has a 6-hour half-life. What that means is if you drink caffeine at noon, half of that is still in your system at 6 p.m. Same thing with, digestion takes a lot of energy. So ideally you don't eat within 3 hours before bed. And we do want to limit alcohol consumption. Alcohol actually interferes with normal sleep architecture. So even if it's just one drink, you do want to do it earlier in the day rather than later in the day because it interferes with REM sleep. And so back to that bedtime routine, there's a couple options for people that I've shown on these slides. So meditation has actually been shown to help with insomnia. And it's really for those people who feel like their mind's racing before bed. It can help with calming that if you do it as part of a bedtime routine. And then I use this a lot with my patients. Journaling about concerning topics. So a lot of us, when we're struggling to fall asleep, it's like I have to do X, Y, Z, and all these different things that you don't really need to think about right before bed. So what can help is actually journaling about those things, or even just keeping note cards by your bed, writing the things that you have to do, writing what you're going to do to address it in the tomorrow. And then what I always like is ending with gratitude. And that was actually shown in a study. So you end with gratitude, and then that can help decrease the time it takes to fall asleep. So this first integrative consideration in terms of a treatment for insomnia is actually not so integrative. It's called cognitive behavioral therapy for insomnia. And it's not really like your conventional psychotherapy. It's actually more of like a class. And what it does is it targets behaviors, thoughts, and associations that patients adopt as they cope with poor sleep that are ultimately maladaptive. So what does it involve? It involves sleep hygiene, relaxation training, stimulus control therapy, which we'll get to in a second. And also, for some people, and this really should be done with a professional, sleep restriction. So UCI is actually the first line recommendation for treatment of chronic insomnia, and this is as recommended by the American Academy of Sleep Medicine. So this is the big academy that comes up with all these guidelines. So that's really the main way to treat insomnia. Otherwise, you also want to look for any underlying causes, and this is obviously in consultation with your physician. There's numerous different things that can actually cause insomnia that we don't think about. So obviously any mental health conditions, you want to treat those. And then medical problems like acid reflux or restless legs or sleep apnea. These can also cause insomnia. So as I mentioned, stimulus controlled therapy is a component of CBTI, and the research suggests it's actually more effective than sleep hygiene. And so what stimulus controlled therapy is based on is this idea of conditioned arousal. So whenever we struggle to go to bed and aren't asleep, we kind of flip the script in that the bed becomes a place where your brain has decided to struggle to fall asleep instead of actually fall asleep. So you become more awake when you're actually in bed. And so we want to focus on reversing that process. So how do we do that? You really want to go to bed and get up at the same time every day. That goes back to the circadian rhythm that we were talking about. The body kind of likes a routine. The body likes habit. It's on a 24-hour clock. So go to bed and get up at the same time if possible. Another thing that people do when they struggle to fall asleep is they actually go to bed even earlier. They say, hey, I'm going to go to bed earlier to make sure if I'm in bed for 12 hours, I get 8 hours of sleep. That actually doesn't help because all you're doing is you're staying awake in bed. So you actually want to, if you are struggling, shorten the amount of time you actually spend in bed. Sometimes 7 hours, sometimes 6 hours. And then as you're sleeping better, you actually expand that window. This one, admittedly, even is hard for me to follow. But we don't want to be struggling to fall asleep in bed. So if you can't fall asleep after about 15 to 20 minutes, the recommendation is actually to get out of your bed and do something else. And so obviously don't do something ideally that involves screens, but go to a lounge chair. Low lighting is fine, and read a boring book until you feel sleepy enough to go back to bed. Last bullet, we really only want to use the bed for sleep and sex. It's again the same idea that if you're doing anything else in your bed, like working or reading or watching TV, ultimately you're telling your brain that your bed is not a place for sleep. It's a place for all those other things. Two free apps that I've found useful are actually CBTI Coach and Insomnia Coach. And they can kind of go through these CBTI principles with people and to help them hopefully get better sleep. That being said, if you're still struggling after you use one of these apps, we do have a sleep medicine specialist within UCI who can do a full evaluation and then recommend cognitive behavioral therapy for insomnia with one of our sleep psychologists. There's actually one of them here at UCI. So I don't really talk too much about supplements in this talk, but I think a lot of people end up using supplements for sleep. So I figured I'd, give my 2 cents. So melatonin is widely used and probably, in my opinion, overused. The evidence suggests you should really only be using it to shift your circadian rhythm. So what that means is if you are jet lagged, taking it at 30 to 60 minutes before your desired bedtime can be helpful. And for those who are actually trying to shift, so let's say you like to go to bed at 1 or 2 in the morning, but for whatever reason need to be, going to bed at 8 or 9 or 10 in the evening, that's when melatonin is helpful. Magnesium is one of my favorite supplements, actually. So the studies vary, but anywhere from 50 to 70% of adults actually have inadequate intake of magnesium. And it helps maintain levels of GABA, and it's also involved in the production of melatonin, which, as we previously learned, is very important for our sleep cycle. And it improves sleep quality. It reduces the time to take to fall asleep, and it improves daytime functioning. The reason I like it so much is because it's safe. The only side effect is diarrhea or abdominal cramping if you take too much. And so that just tells you you need to lower the dose. Formulations are magnesium citrate. So this one is going to be one that's a little bit more, can cause more diarrhea. So, if you're constipated often, this can be something that can be useful. Magnesium L-threonate, there's, some thought that it gets through the blood-brain barrier easier. So that's a good formulation. And then magnesium glycinate. is one of my favorites. It's very well absorbed, and it's paired with this calming neurotransmitter called glycine. So the dosing is 200 to 500 milligrams at night before bed. L-theanine is another one of my favorites. So it's actually an amino acid found in teas, mainly green tea, but also black and oolong tea. And it promotes calm and improved cognition. So this compound is why we think when you drink green tea, you're not jittery from the caffeine. So similarly, it increases GABA, which is this calming neurotransmitter, and it decreases glutamate, which kind of keeps us awake. And similarly to magnesium, it helps reduce the time it takes to fall asleep, reduces sleep disturbances, and it reduces the use of sleeping medication. So it's also safe. There are really no side effects or interactions with medications, and the dosing is 200 to 400 milligrams at night before bed. So I just put this slide about medications just to give you guys my opinion on it. But the American Academy of Sleep Medicine recommends that pharmacologic treatment, so medications for the use of insomnia, should only be used either when someone isn't able to participate in CBTI, those who have symptoms after CBTI, or who require a temporary adjunct to CBTI. And many people are on, some of these older medications that we don't really like to use for sleep anymore. So those are Xanax, any of the benzodiazepine class. So that includes Ativan, Klonopin, and then Z drugs, Ambien, Lunesta. These sorts of drugs should be avoided actually, unless absolutely necessary, because they do have severe side effects. They don't even get you normal sleep. You're actually not getting REM sleep when you're using these medications. So if you do have to be on a medication, trazodone is actually an effective one. It's widely prescribed. It's safe. It increases total sleep time, and it notably does not significantly impact REM sleep. So let's move on to diet. This is a little bit more controversial. There's not as much good evidence, even though you see tons of articles about what food you should be eating. A lot of that research is not of the best quality. And we are all different people. We have different cultural and ancestral roots and ancestral dietary patterns. We have different food preferences, vegetarian, vegan, carnivore, and we also have our unique food sensitivities. What we do know is that a healthy diet is very important. We know that the standard American diet, which is appropriately named SAD, is generally detrimental to health. And so what is the SAD diet? It's going to be processed foods, refined grains, products with added sugars. So here's some evidence for you guys. The SAD diet was associated with higher scores of depression and anxiety. A diet of fish, whole grains, fruits, and vegetables was associated with lower odds of depression in a study of women. There was another study of almost 8,000 children, and they found that fruit and vegetable intake was associated with improved well-being. Fish intake was associated with improved self-esteem. So why do we think this is? So there's an inflammation and a hormonal effect of food. So let's talk about the hormonal effect of food first. So that involves something called the glycemic index. So high glycemic index foods are foods that spike the blood sugar very rapidly. So that's going to be your chips, your candies, your breads, tortillas, basically processed carbohydrates. We find that when you eat something with a high glycemic index, that spikes your blood sugar. And what happens after that is that your body produces insulin. And then insulin drops the blood sugar, but insulin isn't perfect. And oftentimes it actually overcorrects. And so what does your body do to bring up the blood sugar? It produces stress hormones, cortisol, norepinephrine. Again, these things that we sometimes like, but most of the time don't. And a diet high in saturated fat stimulates the immune system. So we think that inflammation is important for general health, mental health. We can't really put a figure on exactly how, but it's probably not a good idea to be eating foods that cause inflammation, such as saturated fat. Here's another recommendation from one study. We want to follow traditional dietary patterns. So a lot of us in the US follow a Mediterranean diet. That's a great one. Norwegian, Japanese diets, also good diets. But the main things we really want to do are the following. We want to increase consumption of fruits, vegetables, whole grains, nuts, and seeds. We want to consume foods high in omega-3 fatty acids. We want to replace unhealthy foods with wholesome foods. That one's kind of, self-explanatory. And then we want to limit the intake of processed foods. So this is the big one. Processed foods can, market themselves as healthy, but the more you process it, the more it strips out the nutrients, it strips out the fiber. They're often putting something, more sinister in those processed foods. And definitely commercial baked goods and sweets as well. So here's some other guidelines that suggested we really want to focus on fiber, vitamin D, potassium, and calcium. And often the SAD diet, the standard American diet, is deficient in many different vitamins and nutrients. Fiber is very important for general health, for mental health. Fiber is associated with more restorative and deeper sleep. And then diets high in fat and carbs actually negatively influence sleep quality. Dietary protein. I talk about protein a lot these days with my patients. It's important for preserving muscle mass, reducing cholesterol, and improving blood sugar, which, as we mentioned from the previous slide, is important to prevent the release of those stress hormones that we have when our blood sugar drops. So what I typically recommend is 1.6 grams per kilogram, which is going to be higher than what you see on the food labels. The food label, which is the dietary allowance, is really only designed to prevent malnutrition. There was a study, and again, I want to focus on prevention for you guys. So this study suggested that higher protein consumption predicted lower depressive symptoms in a study of elite athletes. So talking about trying to prevent mental health symptoms, it may be plausible that increasing your protein intake may help. And so how do we know that any of this works? So there was a randomized controlled clinical trial, which is kind of the benchmark for studies that we look at in medicine, done in Australia, called the SMILES trial. So it was 12-week, it was randomized, and it was a randomized single-blinded controlled study. What they did was they took a dietary intervention, which was 7 individual nutritional counseling sessions, versus a social support group. And they wanted to see the impact on depression. So what was the specific diet they recommended? They called it a Mahdi Med diet, which basically, in my reading, is a Mediterranean diet. So it's gonna emphasize whole grains, vegetables, fruits, legumes, low-fat dairy, raw and unsalted nuts, fish, lean red meats, chicken, eggs, olive oil. And the dietary intervention group, so the group that they were studying showed significantly greater improvement in their depression. And remission, which means they no longer clinically had depression, was achieved for 32% of patients. And so the number needed to treat is a statistical number that we use a lot in statistics that tells us basically how many people need to do something to get benefit. So in this study, every 4th person received benefit from this dietary trial, which is a really good number when you're looking at evidence. So I know that may have been confusing. So this is what I like to tell people, and it's from my favorite author, Michael Pollan. Eat real food, mostly plants, not too much. Now we'll move on to exercise. So there's actually a pretty robust body of evidence for exercise as a treatment for several mental health conditions. My favorite thing that I tell all my ADHD patients is that Michael Phelps actually, so to back up a little bit, Michael Phelps, when he was a child, was diagnosed with ADHD, and he was placed on Ritalin. which is a common stimulant medication that we use for ADHD. And his mom was like, there's got to be a better way. There has to be something else we do. So she put him in swimming. And, he was swimming 3 to 4 hours a day and was actually able to wean off of his stimulant medication completely, simply by using exercise. And there was another study here where they took a meta-analysis of 260,000 patients and showed that people with higher levels of physical activity are less likely to develop depression. Again, focusing on that prevention piece, exercise may help us reduce our risk of developing depression. So here's some more evidence. Exercise increased brain-derived neurotrophic factor. I know that's a mouthful, but it's basically this chemical that our brain produces that helps us grow neurons, develop associations, and learn, and helped improve neurocognition in a randomized controlled trial of a group of individuals with schizophrenia. Exercise is also associated with reducing the sympathetic nervous system. So the sympathetic nervous system is the fight or flight nervous system, and it increased serotonin. These are both things that we try to do when we're treating anxiety. So similar mechanism of action to some of the conventional treatments we use to treat anxiety. Exercise is also very effective as a treatment of depression. So we talked about number needed to treat. The number needed to treat in a meta-analysis of 41 studies was 2 for exercise as a treatment for depression, meaning 1 out of every 2 people benefited. So how do we do it? The largest benefits arise from changing from a sedentary to a moderately active lifestyle. So we want to make sure that we start slow. For some people, walking 7,000 steps at a brisk pace will derive many of the benefits. And we especially want to, do that with older people, so people who are at risk of falling and those with chronic pain. High intensity interval training seems to be the most effective for those with anxiety. So high intensity interval training is when you do something very, kind of all out and then you rest, and then all out and you rest, over a period of like 30 minutes. And then moderate intensity physical activity seems to be the most effective for those with depression. So that can include jogging, strength training, and yoga. Strength training is also just important for general metabolic health. So I really try to recommend at least, 2 to 3 strength training sessions per week. Mind body practices, so yoga, meditation, qigong, tai chi, have been shown to be beneficial in schizophrenia and PTSD. But again, most importantly, we want to do the exercise that someone finds enjoyable and will be easy to perform regularly. So this is also mainstream. This study is actually an exercise guideline for the treatment of depression, and it was published last year in the Canadian Medical Association Journal. And so what I want to highlight from this slide, this first bullet talks about a lot of what we talked about, a number needed to treat of 2. And most importantly, I wanted to highlight number 3. So exercise prescriptions. They use that word prescription. So we really should be asking for, when we go to our doctor's office, a prescription for exercise. It should be specific. So we want to specify the frequency, the intensity, the time, the type of exercise. And so the second sentence is important. Moderate to vigorous intensity aerobic or resistance exercise for 45 to 60 minutes, 3 to 5 times a week, has been shown to have antidepressant effects. And then the last bullet is exercise is generally safe, which kind of makes intuitive sense, but the evidence also suggests the same. So now we'll move on to some non-pharmacologic techniques. So meditation, one of my favorite things. I did it before I gave this talk. It has a large body of literature and has really become mainstream. It's safe, It's effective for almost everyone. I'll make the caveat that for those with severe acute PTSD, you really want to be careful and you want to make sure you talk whoever that is, if you're going to be recommending it to someone, or if you can yourself have it, you talk about your healthcare provider before starting it, because for some people it may they may re-experience that trauma. But for everyone else, it's very safe. And smartphone apps have made it very accessible. So these are 4 that I really like, and I recommend to my patients almost on a daily basis. Calm, Headspace. I recently found out that it's no longer called 10% happier, now it's just called Happier. Maybe because people are more than 10% happier when they use it. And Waking Up. And so they cost about $5 per month. And the way I talk about this with patients is it's really the same cost as a medication copay. You go to your pharmacy, you pay your copay, kind of treat meditation like you treat your medication copay. And so the same way you take your medication, you want to do this every day. 10 to 20 minutes a day is ideal, but lesser amounts are even beneficial. And throughout the year, there are mindfulness courses offered here at the Samueli.institute. So what's the evidence to suggest that meditation is helpful? This was a recent trial where they compared meditation, or more specifically, mindfulness-based stress reduction. Mindfulness-based stress reduction is basically just a class about mindfulness and meditation. Versus escitalopram, also known as Lexapro, which is one of the main medications we use to treat anxiety. So what they did was they divided the participants, 276 participants, into 2 groups, and they either gave one group escitalopram and one group a mindfulness-based stress reduction course. And what they found was that both interventions reduced anxiety symptoms. And so what they were able to say was neither was inferior to the other. There are going to be differences, right? So a mindfulness-based stress reduction course is going to be more time intensive. So more people are going to drop out due to time limitations. But there are really no side effects. So the people and that's what they found in this study, was that the people who did the escitalopram group were more likely to experience side effects. So now on to breath work. So what is breath work? It's a deliberate control of one's breathing. And it's an ancient practice. So pranayama breathing, if any of you do yoga, dates back to 3000 BC. And there was a recent meta-analysis that showed that breath work was associated with lower levels of stress, anxiety, and depressive symptoms. So again, with the theme of this talk, breath work is something that may help us prevent symptoms from becoming disorders. This is still a rather new area of study, so there's less evidence on how to specifically do it, but there are a couple options that I'll detail here. So biofeedback is something that our naturopathic doctors do here at Susan Samueli. It basically involves inhaling and exhaling for the same amount of time. They are really good. They hook you up to all these monitors and check your heart rate variability. So that's something that is a useful tool. And these last 3 are different types of pranayama breathing. So box breathing, you inhale for 4, hold for 4, exhale for 4, and then hold for 4. So it's like a box. And then there's the 4-7-8 technique, which was developed by Andrew Weil, where you inhale for 4, hold for 7, and then exhale for 8. And then the physiological sigh, it seems kind of silly, but you basically take a huge breath, and then you suck up just that last little bit of air, and then you exhale. You can look those up on YouTube if that's confusing. We're almost done here. So acupuncture has also become mainstream. It's widely used for the treatment of pain. Medicare actually covers acupuncture for the treatment of chronic low back pain. And randomized controlled trials have shown efficacy for depression, anxiety, and ADHD. We do have that here at the Samueli.institute. It's covered by many PPO insurances, and you may need a referral in some insurance plans. So I just have one slide on supplements. As I mentioned, that's not really the topic for today, but I'll just give you kind of my opinion on things. So I think supplements, as I mentioned on my first slide, they can be good, but they can also, not be as good. And they've been touted for, all these different benefits. And there's lots of articles and news reports about specific supplements. And they are often very useful. They're safe, they're well tolerated. There are some notable exceptions, which is why I think it's very, very important that you work with an integrative medicine practitioner before starting any supplements, because they do have interactions with medications. One common one is St. John's wort, which if you take with an antidepressant can increase your risk for something called serotonin syndrome, which is very dangerous. But they often have more subtle effects. So you often have to use them in combination. So my personal opinion is of something called precision medicine. So really you want to supplement what is deficient, and then you want to use medications, supplements, interventions in combination with these lifestyle modifications. So you have all of these different routes of healing that can make you more resilient and more robust if something does happen to you. And again, really want to be using our integrative medicine practitioners to help with that. So this is my last slide. Lifestyle modifications can be powerful tools to improve mental and physical health. Kind of like supplements and medications. Again, they work in parallel, so they have additive benefits. So the way I practice is I give people all these options, and then oftentimes they pick and choose the things that work best for them. It's safe. They're safe. They don't really have side effects except those important ones that we mentioned. And they really should be part of any treatment plan for someone with mental health concerns or general mental and physical wellness. Excuse me. And with that, I'll take some questions.
I have two that are posted on the Q&A. One of them is, they're both anonymous, but when you feel down and cannot do what you're supposed to be doing in your day, what is the best approach while maintaining efficiency?
Okay, so to reiterate the question, when you aren't feeling motivated,
Right.
what do you do to get on with your day? Something I found useful, and this is not something that I talked about, but is using cold exposure therapy. So like a cold shower. I actually took a cold shower before this talk, and it really wakes you up. I didn't get into this with the data, but I guess there are some studies that suggest it increases norepinephrine and dopamine, some of these compounds, that help us with energy, with focus and motivation. But what I would say is, again, it's really about developing a holistic treatment plan. Like you said, many people come to me and they don't feel motivated enough to do the lifestyle modifications that they know will help them. So that's where we really want to, look at any underlying causes, look at any root causes of that. Do they have iron deficiency anemia? Is there, B12 deficiency? Is the thyroid optimized? So really making sure you take a look at your whole health and seeing where you can maybe somehow improve the energy. And then if not, as I said at the outset, maybe that's where you use medications. And medications and supplements, those can be used in the short term to kind of get you to this place where you can then engage in those lifestyle modifications.
Thank you. I love cold therapy. I love to rinse in cold water after my shower.
It works so well.
Oh, it really does. There's another one. My partner is resistant to mindfulness practices and doesn't like to sit still. What are some practices that are active and helpful, and any way I can get him on board?
Yeah, that's a great question. And I think what that does is that gets at the preconceived notion of what mindfulness actually is.
You might want to repeat the question.
Yeah. So for those who are listening online, the question is, my partner is not interested in mindfulness, can't get behind mindfulness, can't sit still. How do I get him on board, or him or her? And what I was getting to was basically, a lot of people tell me, they say, hey, I can't do mindfulness because I can't shut my brain off. If you listened to a lot of the mindfulness talks and you've read the mindfulness books, that is not actually the aim of mindfulness. The aim of mindfulness is not actually the absence of thought. It is the exercise of recognizing your thoughts and then coming back to whatever the mindfulness technique you are using is. So for some people, that's going to be coming back to your breath. For some, that's going to be doing a body scan. And where you derive the benefits is the repeated recognizing the thought and going back to whatever exercise it is. So that's where the benefit is. To answer that question further, sometimes it can be hard to sit still. Admittedly, as someone who finds it hard to sit still, so you start very slow. You start with very short increments. Again, starting with 1 minute, 2 minutes, 3 minutes, and then slowly you find that it's easier. And then another thing that I would suggest is, again, maybe for those who find it hard to not concentrate on something, try breath work. Because breath work, you have to actively count. And so by actively counting, you may find it easier to sit still and concentrate. There was a question in the back.
Can you explain to us, like for cold therapy, how cold does it have to be and how long do you need to do it for?
Good question. And admittedly, this isn't my area of expertise, but from what I understand, what I've listened to on podcasts, it depends on how cold it is. The colder it is, the less time you have to spend it. So that can be as cold as, like, freezing, basically. For that, I think, you only have to spend 30, 60, 90 seconds. If you do something like around 50 degrees Celsius or 50 degrees Fahrenheit, excuse me, then that has to be for around like 30 minutes. So it really depends.
And that helps with what? Physiologically? How does it help you?
Physiologically, if you've done it, when I do it, I feel like I was, shot out of a cannon, basically. It increases levels of norepinephrine, increases levels of dopamine. For those who maybe are struggling with low energy, low mood, low motivation, that can be a strategy.
Thank you.
I've actually done ice baths, about 34 degrees for 6 minutes. It is fantastic. And if you do the breath work before you get into it, then you can regulate your breathing in a way that while you're in the ice bath, you're in control of all it. Like you just get so into the breathing itself that the temperature in your body will regulate itself. It's fascinating.
Thank you for sharing that. So that's good. So you said 34 degrees Fahrenheit for 6 minutes.
6 minutes.
That's long.
It is long.
I think, there's one in my gym that I do on occasion, and you do some type of breath work to kind of regulate your breathing and your heart rate, and you stay in there for a couple minutes, 2 to 3 to 4 minutes. So
I'm gonna botch it, but I think it's called hypertrophic breathing.
holotropic.
Holotropic.
That's one type. Yeah. Another question.
I noticed that CBD isn't addressed at all in the presentation, and I didn't know is that partly because the research is still hasn't been completed, or any thoughts?
Yeah, thanks for that question. So for those online, the question is, can you address CBD? CBD, like the compound found in marijuana. So I've looked into this, and there isn't a lot of data. Definitely not at the level of the data for exercise, for example, to say that it helps. And I think you run into many of the issues that you run into, and kind of probably on a larger scale with supplements, where you don't really know what you're getting. You don't know what the compound is, what the purity is. And so it's not something I typically recommend in my practice. That said, I mean, I've watched those documentaries on CNN like 10 or 15 years ago where, you know, CBD helped children prevent devastating seizures. So there's clearly something there. And now that specific compound is an FDA approved compound that they use in epilepsy. So I think that would be an area that would be interesting to study to see if you could utilize that compound that's already FDA approved and see if, you know, that may have benefit with mental health symptoms. But at this point, it's not something I routinely recommend because I don't think the evidence is necessarily up to par.
It's obvious too, just the regulation of it.
Exactly. You know, so any of those things that aren't FDA approved, it kind of, for me, I think about it like a hierarchy of evidence, right? So medications probably have the most evidence. We can talk about the politics and the reason behind all of that. And then from there, lifestyle interventions probably have the second most.
I don't have any more questions online, but someone said truly inspiring and impactful presentation. Thank you.
Thank you, guys.
Thank you.
Great, thank you for everyone who joined us virtually tonight on Zoom. When you close the presentation, you will receive a link to a valuable survey for this event. Please, please, please help us improve our community offerings by letting us know what you think. We will also be emailing the link to the recording and key takeaways to the email address provided at registration. Our next Integrative Insider Live event is scheduled for March 26th with Dr. Heather DeHaan presenting on women's health and functional medicine. More information will be sent through our Integrative Insider monthly email newsletter and posted on our events page on our website at SSIHI.UCI.edu. And lastly, please save the date for our 23rd annual Women's Wellness Day on Friday, May 2nd at Balboa Bay Resort. Registration will be opening in just a few days, if not in the next week or so, in February. Thanks again, and we will see you next time.